The Brazilian Ministry of Health estimates an average of 2.5 hospital beds per 1,000 people. The state of Rio Grande do Norte has 2.37 beds per 1,000 people, which represents 95% of beds recommended by the Ministry of Health and the World Health Organization. So why do we see every day in the newspapers overcrowded hospitals and patients suffering in the corridors? The problem is the lack of management and control of hospital beds turnover. Patients who should just spend a few days in the hospital are occupying beds for weeks or even months. Every day, many patients are admitted to these hospitals, but the number of patients leaving is not always equal to the entering one, which generates lines and considerably increases the cost per bed. These patients are occupying beds for different reasons, such as insufficient doctors available, lack of medicine, lack of medical exams, etc. There are hospitals where a nursing station takes care of up to 60 beds. The records are crammed into clipboards and folders, which makes information extraction extremely hard. Nurses and doctors need to identify which patients are there and the reasons that make them remain hospitalized. The system provides information in a simple and objective way. Through monitors at their nurse station, the technical team has a clear vision of the clinical status of all patients through a video panel. Based on a Japanese methodology called Kanban, each state of the hospitalized patient is translated into a color. Green for patients who were hospitalized recently, yellow for patients who are already in a period when they should have had medical release, and red for patients who are exceeding the ideal medium state. The visual monitoring of all patients' outcome makes possible for managers to easily trace most effective policy measures and identify sectors that are being unproductive, reversing this situation. We implemented the system in the largest hospital of the state, the Valfredo Gugel Hospital. They already had a hospital management system which was developed by a company with over 10 years of experience in the market. We convinced the managers to change to our system and we proved the benefits of it early on.
We studied the flow, we timed the process, we saw where time was lost. And the first day of training, we reduced the registration time of new patient from 9 to 3 minutes.
For patients, this means less time in lines, filling out unnecessary admission forms, and it represents an optimization in the process to the clinical healthcare.